Well, most people know that Grameen Bank is practically synonymous with micro-lending. Fewer people know that there's also Grameen Kalyan, which is referring to the health arm of Grameen. And this Grameen Kalyan, Grameen Health, focuses on providing health care to the rural areas. I'm very pleased to be speaking this morning with Imamus Sultan, who oversees a lot of the health operations in Bangladesh in the rural areas. Now, Mr. Sultan, in terms of what Grameen Health is doing, can you really address some of the challenges that healthcare in general has in the rural areas of Bangladesh?
Okay, basically Grameen Bank work in the health in many dimensions. One, we are running from Grameen Kalyan 53 rural health centers. This is in the community, within the community in the rural area. We are operating 2 eye hospitals, which is in the urban area, but we are covering rural people also through organizing camp. We send the team in the rural area to operate this camp, and we bring the poor people to our hospitals, and we do operation, sometimes subsidized, sometimes free of cost if they are unable to pay the money. At the same time, we started to create a nursing college, which is a plan that Bangladesh has severe scarcity of nurses. We have 3 doctor, 1 nurses like this, just opposite of the World Health Organizations that they used to say 1 doctor should have 3 nurses. So we have the opposite scenario. So we thought that we need these people to run. And we are facing major challenge of retention of health professionals, the doctors and the paramedics in the rural area for a long time. So that is
Why is that? Why is there such a shortage?
Okay, this is the government institutions. There is legal restrictions of institutions. There are private, but quality is not well. Then the nursing profession is not well recognized or well placed in Bangladesh. So that could be one of the reason. And there is also a kind of attitude among the people that basically in Bangladesh, nurses used to come from the very poor family,
yes,
who cannot afford, who have no access to other education.
Because
so
the attitude is they don't really want the women in this kind of work.
Yes, right. So that's why. So we thought that as we are suffering from retention of doctors and health practitioners, we thought that why not we bring the people from the rural area, we train them, and we use them. Why not? So that's how we created a nursing college. First nursing college, you met with Barbara.
Of course.
She is the principal of that nursing college. The whole idea to bring her over there, we want a very international standard nursing college, so that we want to change the attitude of the people that nurse could be placed in very good position. So that's why we want to work on that aspect. And we begin with bringing Grameen Bank borrowers, kids, because this is in 2nd generation, 3rd generation. So we thought to bring these girls and educate them in the nursing and give them the opportunity to join with us in the health sector.
Yes.
And
the response sounds like it's been quite good.
And because as they're from the rural area, they know that their commitment in the society, so maybe they can work, go back to the village. And we are not restricting them because they are paying money for their education. If they want to go abroad, we have no problem. If they want to work with us, no problem. And we will produce more and more nurses, so that definitely we will find many people to stay with us.
Well, how are these programs financed, Mr. Sultan?
This is actually, these girls will pay their money, their tuition fee, and it is very high cost, like other private university charging. We are charging almost same prices.
And the families can afford that?
No, family cannot afford that. So we decided that Grameen Bank will provide loan to them, because Grameen Bank has education loan program. So Grameen Bank will provide loan to them, and we said to repay the loan, we will assure the job. Grameen Health will assure job for you. So immediately after your graduation, you join with us, you get the job, and you do the job, prepay your money.
Yes.
Then you have many other options. You can go to the international market, you can go to the other big organization hospitals, so you can earn money, you can repay money.
And can this system be sustained solely by doing it this way?
I think initially we need a kind of support to start up, but gradually it will be run on sustainable basis, and it will be a social business. So in social business terms, which Professor Yunus decided, that it is a kind of investment which the investor will not take back the benefit of the business. Just they will take out their investment on that after a certain period. And whatever profit come, it will reinvested, reutilized for this expansion of the program.
Okay. So what is your vision for what this will become and grow into in the future?
Okay, in all Grameen Bank program, all Grameen Bank health program, like from primary healthcare center to the nursing college to the eye hospitals or whatever hospital we will develop in future, all will be sustainable, will run on sustainable. This is our main vision.
As it is operating now?
Yes. Within a span of time, like other business, it will be sustainable. And the profit will remain over there. We are not going to maximize the profit, because this is not our intention to earn more money. We can do that. We can charge higher like other private organizations. No, we said that it should be affordable.
Yes.
Affordable and sustainable. This will be the main goal two goals of this.
I see. And do you believe that you also need some international support for this going forward?
Yes, for create this type of organization, because I am not long time working in the health. Just it is my fourth year running in the healthcare services. And what we realized that if we developed a healthcare services famous like Grameen Bank, or if we want to reach our goal, we need a comprehensive healthcare program. And if you see the all successful institutions, they have the comprehensive program, so that the integrated program to make it good. So we are looking for, that's why we are planning, as we are unable to retaining doctors, we thought to go for a medical university or medical college, so that we can develop our people, we can open the door for them, so that they can study here, they can job here. And if you find that there will be a dropout, the doctors will go outside, not work with us, we can recruit 10 from the very poor family. And we can say that you need not to pay money for us, you just work, we will pay money, and you will study here 5 years, and you will work with us 5 years to repay our money back. And you will get your salary as it is, whatever. So there are many ways and means we can do it, but we need to develop this institution. And to develop this institution, we need huge investment on that. Now we are working for creation, establishing a medical, the medical university.
Yes.
And for medical university, we need a hospital, tertiary level hospital. So yes, so this is if we want to develop. We bought the land. We are looking for funding. If we could raise the fund.
Funding from where?
Okay, we are searching the source who are interested, to whom we can pursue. We are looking for.
Okay.
We are now negotiating it, and it is not only funding. We need some type of support as we get from the Glasgow Caledonian. They send Barbara to help us to create a very quality and standard institution. We are looking for other universities can send their faculties for time being. They can we can communicate through internet, the long distance education for that. That's how we can take support from people, many people.
Right. Yeah. Okay, Mr. Sultan, thank you so much for stopping by.
Thank you very much. Okay.
I'm Mabel Jong. You're watching coverage of the 8th Annual World Healthcare Congress in Washington, D.C. Okay.